good boy. Okay, open your mouth. Brush your teeth. I think from young, Dzakir and Dzakwan didn't like their teeth to be brushed. They can't speak. But of course, from their body language, we know, because every time you want to brush their teeth, they will try to run away. Normally, we start with Dzakir first because Dzakir is a little bit more compliant.
Hi, Dzakwan.
Hi. Brush teeth time. Good boy.
It's going to be a lot more physical.
So every time we had to call reinforcement, since everybody had to come and help. How you open your mouth?
I try to.
We were told that because of the size of their head and their jaw is not growing normally, so their teeth are all crowding also. So because of the teeth being like too close to each other, it's also quite difficult to clean the teeth.
We have 4 children. The eldest is Afif. Second is our daughter, Layina. And then Dzakir and Dzakwan are our third and number 4th children.
When I was pregnant with Dzakir and Dzakwan compared to when I was pregnant with Afif or Layina, it was a little bit more difficult. I couldn't eat much. I was literally throwing up every food that I ate, even plain water. During some of the scan, doctors saw that one of the baby is not growing as well as the others.
Dzakir was the smaller twin. He had to be pushed to the ICU also because of his small size. He was just only weighing about 1.6 kilograms. Dzakwan was not breathing when he was born, so he had to go through the ICU to resuscitate him.
I tried to breastfeed Dzakwan, but he just couldn't latch.
The pediatrician at the hospital realized that he has no bowel movement. So from then on, actually, we knew that he has this gut issue.
Who's that? Dzakwan?
As they grew, we saw that something is not quite right with Dzakir and Dzakwan. They don't seem to be babbling. Eye contact also not too much.
Yeah.
Go. At that point of time, I wasn't very worried. I thought that maybe they just need more time. I tried my best to give them a lot of stimulation, talking to them, reading to them, playing with them. When they had fever, suddenly they also get the fits. We really panicked because we didn't know what was going on. We brought them to A&E. The doctor also wanted to do some observation.
One of the doctors noticed that none of them has any of our features. They don't look like any of us. So he started to call all other doctors to come and look at us. I was shocked actually. It was much later when the other doctors started to come and then do the test. Then I realized that they are not normal children.
I met Dzakir and Dzakwan and when they were 15 months old. They were first referred to me because Dzakwan had Hirschsprung's disease. The doctors also noticed that they had features of global developmental delay, and they were wondering whether there was a cause that could unify all these diagnoses together. When they have coexisting issues, that all points towards a more fundamental cause. There wasn't a very clear diagnosis. I suspected that there was an underlying genetic diagnosis, but based on their features, it wasn't one of the common syndromes that we normally see. A lot of genetic diseases are very rare. It's quite impossible for us to have seen all the conditions. Some genetic diseases have 23 or 25 people in the world with it. We may not immediately recognize it. We use genetic tests to try to help us, but we didn't find any genes that were missing or extra. And then the next question now is that if the genes are all there, is there a spelling mistake in the gene? We were only able to send a test for one gene at one time, and it costs about $2,000 for each gene. We have 20,000, 30,000 genes. To go through all the genes, it's really difficult and will be very time-consuming and very costly. Therefore, the Bridges program was birthed in 2014. Bring all the research capabilities and all the access to cutting-edge genomic technology to be used for our patients. For Dzakir and Dzakwan, being in the Bridges program, they've had access to various genetic tests along the way. Very unfortunately, we have not found an answer for them.
Behind got the dessert. You don't put with the top one side.
The girls are here already. Wait. Sit down.
Nothing, no more. It's very small. Clap hand, can you clap hand? Yeah. It's fine. Nothing. Happy birthday. It's okay.
We still haven't figured out a reason why he does not like singing happy birthdays and why he reacts the way he does.
Happy birthday,
I think he really just wants to start singing the song, but because he can't really say words, that's why he feels a bit sad.
Can you do that?
We have 3 girls and 1 boy, and Jayden is our second.
Jayden at the moment, 16 years old, is still non-verbal, but he actually understands when we talk to him. He will respond by nodding his head.
Nice. You see?
Nice, yes. Okay. He lacks a lot of basic human skill, I would say. So he is not able to feed himself or go to the toilet himself or just do simple things like shower himself. So he has to be taken care of from the moment he wakes up all the way to he sleeps. He tends to have mobility issues, right? Because the limbs are not strong to support his body weight.
You chew already, mommy give you a little bit of drinks? Yes? Okay. You must chew, then I give you.
Jayden still have some issue with fine motor skills, like picking up small little things with his fingers. Jayden also have issue with swallowing, so normally we have to cut up his food.
You're almost finishing, Jayden. It's faster than you. You must chew.
Jayden was a normal baby. At about 12 months old, we realized that Jayden is not crawling at all. Neither is he able to actually support himself in a seated position. That was when we suspect something was wrong. When we realized that Jayden was a little bit unusual, we had him seen different doctors. There were MRI done on him. There were spinal fluid, lumbar puncture tests that was conducted. All this came back shows that he was normal.
Well done, Jayden.
We felt lost because we have no ideas what's life like for him. Eventually, we got a referral from a neurologist to actually have him on board of the research program with KKH.
Good try, Jayden.
We didn't really actually saw much of hope. We were just thinking at least we are kept in touch with the medical research. This was one of the last resort left to us.
this? What is this? This is a ball. Yes, Atira, can you see the ball here? See?
What is Atira watching?
Yeah, they're reading. What is this? This is a? Oh, there's no bus here. It's a cycle.
These are our two daughters, Atira, the elder one, and Seana, the younger one.
Seana is very loving. She's very social. She likes to be around people and she's always happy.
That's nice.
Atira is a bit of a silent nature. She likes to spend her time sitting on the bed and reading books. She doesn't like sound and she doesn't like too noisy things or too noisy people. The wheels of the bus go round and round, round and round, round and round. The wheels of the bus go round and round.
Atira was born in India, and until the age of 3 months, the initial milestones were quite normal. At the age of 6 months, we expected her to sit, but even at the age of 9 months, she was unable to sit.
When we met the pediatric in India, there were a series of tests that we were asked to do, both for Atira and us as parents. So these tests did not show very abnormal outcomes. They were all said to be normal. The only thing that doctors told us is her muscle tone was weak.
Atira was able to sit only at the age of 3 years plus, and she walked only at the age of 5.
And we had frustration because we used to go to the doctors and doctors used to say, we don't know what her exact conditions are.
Okay, come. Hold the pencil properly. Hold. Color the circle. Blue.
Ah, that's nice.
Atira loves to scribble actually. If I give her a book and a color pencil, she just keeps scribbling everywhere, and that is how she passes her time. Atira, hold the pencil properly. Hold the pencil properly. Okay. Scribble, scribble, scribble the sun, sun, sun.
We didn't want to go in for another baby so soon. It was only after Atira started walking and things were a little better, then we decided to have another baby.
And before we went in for the second child, we wanted to do all the tests and see if there is anything that tells us is not right. There were multiple tests, both for Suman and me. It was said all is okay, right?
We thought, okay, I think we can go ahead with having another baby. When Seana was born, I was not concerned whether she would be a special needs. I didn't have any worry at that moment. Everything was normal until the age of 3 months. Her milestone started getting delayed.
Yeah. Oh. Wow.
Hey, not bad. It's so clean. The last time I saw this place, it was dirt.
Okay, so we have to start cleaning up a bit. So we need to first of all vacuum the living room. Then we mop some of the TV console area. Yeah? Okay? Yeah. Now, Jayden and sibling were sharing the same bedroom. This new home that we actually got was bigger and the girls need their own rooms now. It's time for Jayden, him to have his own room. While waiting for his diagnosis to be out, we are dealing with his condition the best we can. We were very paranoid because not knowing his condition, you also do not know such kind of kids, what kind of lifespan they will have. So there's a lot of uncertainty.
Now I'm gonna help you a bit, okay? Push your bum a bit higher. You can do it.
Okay, boy. Oh, well done. Good boy.
We actually put him on early intervention program with AWA Center. From there, there are a series of therapies that he go through on 3 times weekly. They have the physiotherapy, they have the so-called speech therapy, they also have the occupational therapy and hydrotherapy to strengthen his legs muscles. In hydrotherapy, they actually train him to walk independently in the pool. He loves swimming.
So the reason why we chose this space was partially because it is near to amenities such as the swimming pool.
This is Jayden's room. So he chose this room himself because it faces the pool.
All 4 of the kids sleep in a single room because they are young. Also to have someone look after Jayden at night. But now this is going to be a first new experience for him.
This is the first time that Jayden will have his own room.
We are still following up with these doctors for ENT, for orthopedic, for eye, dental.
Just to see whether there are any new other issues that pop up.
We have been seeing these doctors for more than 10 years, some as long as 15 years.
Today we're gonna bring Dzakwan for his dental appointment.
Dzakwan good? Show me how you're going to be good. Good.
From the previous dental assessment that he had, so they found cavities. Hi, hello.
Here's your number. You want to sit down here? Okay, so we get Dzakwan to take out his mask and then we have a look at his teeth, okay? Yeah?
Dzakwan has more cavity, so that's why the dentist will want to see him earlier than Dzakir.
Remember the toothbrush? You brush the teeth? Okay? Yeah? Okay, Auntie Pearl, hold your head, okay?
We brush your teeth, okay? Brush your teeth.
Initially, I did see that Dzakir Dzakwan don't seem to develop as well or normally as other babies.
One more time. Yeah? Daddy just
Pains me to see them going through all this, but I just have to be strong.
Okay, we brushed the bottom already, let's brush the top. Okay, come let's have a look. Yes. Yeah, very good.
As time goes on, we realize that there's no answer to their condition, and there's a lot of research and tests still need to be carried out in order to find that answer. So meanwhile, we know that we still have to go on with our life.
We just brush this side, then we finish, okay? You want to put this one? You like the banana toothpaste? Okay. There we go.
You want to do it
You want to do it yourself? Thank you. You can be my assistant today.
Milestone. Right, Dzakwan, right? Good. Dzakwan,
Yeah,
hey,
good
good.
work.
Dzakwan, say good. Dzakwan, good.
You did very well today.
For me, I would still want to know the actual result of the condition. Although life still goes on, that question still lingers behind my head. Eventually, there has to be some kind of answer to what they have. There should be some medical explanation. I'm sure that we are not the only parents having children like this. There's to be some kind of research done somewhere. Right now, it's almost 17 years of waiting, and I'm still hopeful of having a proper name for the condition.
Yeah. Seana, come. Come. Good job. Come. Come look here. Look into the mirror. Come. Comb your hair. Comb. Comb your hair.
Seana rolled at the age of 3 months, and she was trying to roll back by around 4 months, and that was when we realized that she was trying to but was unable to.
There was no conclusion to Atira, why it happened, what was the cause and what she was going through. And then we had Seana, who was again showing those symptoms, delayed milestones, right?
I would go to bed in the night, and I realized Atira would fall asleep and my husband would fall asleep, but I would be just staring at the ceiling and crying on my own.
We definitely did not expect that. We thought our second kid would be normal. We did feel that pain again. We have to start our journey all over again with our second child.
Are you happy today?
Let's go to meet Dr. Tommy.
Hi, how are you?
Both of them had problems of development. They had epilepsy and speech impairment. Looking at them, they did have features that resemble a syndrome called Angelman syndrome. That test came back negative. My next thought was, possibly this could be the world's first case of a new syndrome.
Do you want to go in? Do you want to have your bath?
Atira was off seizures for 13 years, but this year she had 2 seizure attacks.
Let's go and see your
Let's go and see your room.
So today you will be sleeping alone here. Okay?
Okay.
Oh, okay. 1, 2, 3.